Hi, I'm Dr. Michael Miyazaki, and in this episode, I wanted to cover something a little bit different. One of the things that I do is teach a live patient veneer aesthetic mini residency. It's one of the things that I've done for almost 30 years, probably a little bit more, but I really enjoy doing it because we can take dentists, young dentists, and even experienced dentists, and we can usually share some ideas, and hopefully our ideas make their lives easier, and the ideas that they give to me make my life easier. So it's a little bit of an exchange, and it works really, really well. We have camaraderie amongst our group. We've known each other for decades, those of us that are instructing, but every time we have new student doctors take our courses, it's just really fun. We just want to have a good time, and that's how you learn. So what I want to do is I just want to cover this to get you thinking. We're at the beginning of the year. This kind of shows how our courses run. It's a multi-day course where we do lectures and live patient treatment. We have a great lineup of instructors. You see them in the center here, and it just makes the course really fun. Oh, in the center we're missing Dr. Jack Griffin. But we have Dr. Rossi. We have Garrett Caldwell, who's the CEO of the program. Dr. Herman in the back. Dr. Franklin towards the front. Gary Vaughn, the chief lab technician. We also have another technician, Ryan, who's also at the course, and Dr. Smurthwaite on the far right. We're using his office to conduct these courses. And it just makes it really fun. Ryan Core and Gary Vaughn, they do a great job making sure all the lab work is the way it should be. We have diagnostic wax-ups done before the course. We have the temporization stents, the preparation stents, and we have a chance to review everything before the doctors see their patients during the course. One weekend we prep all the teeth out, the lab takes all the preparations, and then they fabricate the restorations, and during the second session we get to see them all. So the doctors learn a lot, the patients leave with a great experience, and it's just, like I said before, it's just really enjoyable for all of us to be there. On the far right hand side you can see we're working with the doctor, and it's just, as colleagues, we're just making suggestions, recommendations. The doctor's then doing the actual work, because there's no better way to learn how to do something like aesthetics than to actually do it with some watchful eyes over you. What our eyes are is just different perspectives, and so we're able to look at the patient from a different perspective, and oftentimes it's that perspective that we wish we had in our office, because when we're doing a prep and it takes a while to get the preps done, our eyes don't see everything. So we want these cases to be as perfect as can be. So having a second, third, sometimes even a fourth set of eyes to help us out really, really does make the course a lot easier. One of the things that I stress to all the doctors is, how do you find these cases? I meet doctors all the time who say, I'd love to do aesthetic cases, but my practice doesn't have any patients that want aesthetics. And so I look at the doctors and I go, I think really what it is your eyes don't see the possibilities yet. And so when we do a course like this and we talk about smile design, you see different patients before and after as you watch the doctors work on their patients. When you leave a course like this, oftentimes you don't have the same set of eyes. You have a set of eyes that sees the possibilities. And I've received communications from doctors that attended our last course saying now they're seeing more of the possibilities of the cases that they can make recommendations for aesthetics to their patients, and they're starting to do more aesthetic cases. And I think aesthetic cases are really important, because one of the things that we have to recommend to our patients is not only, do you have teeth that hurt, do you have gums that bleed, but do you like your smile? Do you like the color? Do you like the shape of your teeth? Do you like the way that they're aligned? Those are questions we need to ask our patients that I think today are just as important as diagnosing gum disease. So what I always tell the doctors is that after the course, they will have new eyes, and they're going to have more confidence, because unless we have confidence, we're not going to recommend aesthetics. If you've never done a veneer before, you're not going to walk up to your patient with crooked, dark teeth that are worn and say, hey, have you ever thought about veneering your teeth and having whiter, longer, more beautiful or stronger looking teeth? We just don't do that because we don't feel comfortable. So what I recommend to the doctors is, when they start out, again, we want to get a little bit deeper. What happens to a lot of us is we have that quick first visit. Sometimes, and I've been guilty of this, I had the patient come in, they had dental insurance, they call our office, hey, I just got dental insurance, can I come in for one of my free cleanings that I get? I think I get 2 a year, and my office would say, sure, come on down, we have an opening at 8 o'clock, can you make it? Patient would say, sure. Patient would come into the office, be seen by the dental hygienist. The dental hygienist takes the x-rays. Then I go in towards the end of the visit and I look at the x-rays and tell the patient, oh, you've got a cavity here, cavity there, or hopefully I'd say, everything looks really good. But because it was such a fast exchange, the patient wanted to get the clean done because that's what their insurance covers. But if they needed more work, I really didn't have the eyes to look for that. If they had worn teeth, as we mentioned before in past programs, I didn't have a chance to offer them the ability to fix the worn teeth or to figure out why their teeth were wearing down. So what we try to do today is the patient calls in, or maybe today they interact with our office by an email, and we just want to welcome them to the practice, make sure that they feel like they're welcome and give them a warm reception. We tell them how we're a little bit different, and today that difference usually is reflected in our websites. And then when we make contact with the patient, we just let them know what to expect. What we're going to do is we're going to have a new patient visit, and that visit's not going to include a cleaning because we don't know yet if that's what's best for the patient. But what we're going to do is we're going to kind of baseline the patient. So we're going to look at the gums, we're going to look at the teeth, we're going to look at the jaw joints, we're going to do an oral cancer screening. We're going to really make sure that we understand what the patient wants us to focus on. We're going to discuss the services that we offer, and the nice thing about it is when the team is taking care of the patient, either during the initial phone call, initial emails, or when they come into the office, the team can brag on you a little bit, right? I can't say, oh, you're so lucky to come and see me because I'm the best dentist in the world, but your team can say, hey, you're really lucky that Dr. whatever your name is can see you because the doctor does a great job with his work, whether it be restorative, aesthetic, TMD, implants, whatever it is that you do in your office. And what you have to do is train your team to remember to kind of brag on you because the patients, they're still trying to develop some trust in you. They don't know you yet. So then we do a comprehensive exam. With the comprehensive exam, we spend the time to build some rapport, ask the patient what's really important to them, and then we adjust those concerns. If I'm concerned about, this is a patient that has dark teeth, worn teeth, crooked teeth, and I start talking about veneers or ortho or whitening, and the patient has no interest in that, then we've got this disconnect and we're not going to go much further. So what I need to do is first ask the patient, what can I help them with? What is their focus? What is their main concern? And sometimes it is, my teeth are dark and they've got cavities, but their main concern is the teeth are dark. So what I need to do first is address, we've got some cavities here, but I understand your main focus is you want to have whiter teeth. So what we're going to do is we're going to try to take care of both. How does that sound? And, if we take care of both our clinical concerns and their clinical concerns, then we're going to build that rapport and build some trust. Just tell the patient what I'm going to do is I'm going to tell you, what you have going on in your mouth. And don't say, we found this or found that, because a lot of times patients are funny that if they walk in and they have cavities, they don't think they had cavities until you said, oh, I found a cavity between these two teeth. So, what you have is you have two cavities. Would it be okay if I just made some recommendations about how we would take care of those cavities? Sometimes those areas of decay are really deep, and it's not just a filling, but maybe we need a root canal, maybe we need to extract the tooth. And so I need to discuss with the patient what the recommendations are, what the possibilities are, and then we have to come up with an agreement about what's comfortable for them, how would they like to proceed. And I think today we also have to bring up aesthetics. What I notice is your teeth are very worn, or your teeth are very dark, or your teeth are chipped, or they're very crooked. Has that ever been a concern of yours? And if the patient says, you know what, I've always wanted to straighten my teeth out, I just never knew what we could do, then I just tell the patient, hey, we've got some clinical things we have to take care of, but I'd love to talk to you about what some of the possibilities are. And they really appreciate that. So just offer them the best, because what some of us do is we sit there and think, well, if I get into ortho and maybe whitening and then maybe veneers, that's going to be $10,000, and that's a lot of money. And I agree with you, and I think we should be sympathetic to our patients and to possible budget constraints. But what I want to do is first offer the patient the very best. What I notice is your teeth are very crooked. What we could do is we could straighten your teeth out. Or your teeth are very worn. What we could do is we could do veneers to take care of the worn appearance of your teeth. But offer them the very best. And if the patient says, I would love to do that, I've always wanted to do veneers, but I just can't afford it in my budget today, that's okay. Let them know what the possibilities are. We don't have to do it now. We can revisit this a year from now, 2 years from now. I've had patients where, 5 years later, they say, hey, what we were talking about many moons ago? And I look in my notes, oh yeah, we were talking about veneers and whitening. Well, is that something that we could do? So sometimes it takes a lot of time to get there. But hopefully when we develop the treatment plan, they feel good about it, I feel good about it, our team feels good about it. And just let the patients know, hey, you've got some responsibility too. We're going to clean your teeth up because you haven't had cleaning a long time. The gums are a little inflamed and they bleed really easily. And I know you want to do the veneers, but in order to do the veneers, your gums have to be healthy. And so let the patient know that they've got some responsibility as far as the treatment plan and the final success. And let them know in some cases, if we can't cure them, let's say with periodontal disease and advanced periodontal disease, we may not be able to cure you, but we can help you manage. And I think one of the important things is we don't want to overpromise, but we do want to overdeliver. So, don't promise them the world, but try to deliver more than they expect to them. Because in today's society, a surprise like that to get more than we thought we'd get, that's a great thing. So what I want to do is I want to make sure that our patients know that we're listening to them. And we have an intake form that asks them, do you like the appearance of your teeth, your smile? Are your teeth all in alignment? Do you have spaces you don't like to see? Do you like the color of your teeth? Do you like the shape of your teeth? Are your teeth chipped, protruding, hidden? Are your teeth wearing? And are there any areas that you don't like looking at? And a lot of times the patients will say, yeah, I've got these dark fillings in the back. And we look back there and we go, oh, we call those amalgam fillings. And you're right, they don't look very aesthetic. Because what happens is when we have things we don't necessarily like to look at, when we look at those areas out for just a week, we don't see it anymore. We all have birthmarks here or there, or maybe a little skin discoloration. But when we look in the mirror and we see ourselves, we see our hair, we see our smile, we see our eyes, but we don't really see all those little blemishes. And so what a form like this does is just gets the patient thinking about, oh yeah, I do have some teeth that are kind of crooked and I would like to see about straightening them out. Or, my teeth are chipped on the edges. And, I never thought about asking a dentist about what the possibilities are to take care of those chips. And a lot of times what the patients, they habituate to that, so they don't even see those things anymore, but then they just never think about that when they're in the dental office. And so you're just kind of bringing those things up now when you can offer them suggestions and give them the information that they seek. And then what we do is if the patient does want to do something like veneers, we ask them, well, how many teeth do you think we should veneer? And I give them a mirror and I just say, smile. How many teeth do you see when you smile? Do you see from second molar to second molar? And some patients have very narrow smiles. Their lips are just very tight. And you see cuspid to cuspid. So I just ask them, what teeth do you see? Well, I see from here to here, usually at least second bicuspid to second bicuspid. And some patients will say, well, I see from second bi to second bi, from here to here, but I can only afford to do from here to here, maybe cuspid to cuspid. So I just ask the patient, hey, just imagine, what color did you want to go? Pull out the shade guide. Well, the color of your natural teeth is an A3.5, and the color in the shade guide that you said you'd like to go to is a B1. Well, look at the difference between these two shades. So imagine your front 6 teeth are this shade or this color, and the back teeth are this color. How's that going to look? And the patient might say, wow, that's going to look really funny. You're right. How many teeth should I do? And I just tell them, well, when you smile really big and you're really happy, you see from here to here. So we should think about doing veneers from there to there. But, some patients, they go, well, my budget will only allow me to do cuspid to cuspid. And I just tell them, okay, what you have to understand is we can do cuspid to cuspid, but hopefully soon we can do the other teeth, because if we only do from cuspid to cuspid, when you smile, you're going to see teeth in the front and it's going to look like you don't see any teeth in the back. And as long as we let the patient know that, then I'm comfortable doing cuspid to cuspid, although I'd prefer to do second bi in the majority of cases. Another question we often get asked by the patient is, well, if my front teeth, my top teeth are B1, look how dark my bottom teeth are. Is that going to look funny? And I tell the patients, well, we can do whitening down there, or perhaps their lip covers that area so they're not going to see much of that area, or maybe we veneer those teeth too. I have a patient that we did veneers on her upper bicuspid to bicuspid, probably about 3 to 4 years ago. And this last week she was asking me, well, my top teeth, and we went a BL1 on the top, and her bottoms are about an A2. And she goes, how can I get my bottom teeth to look whiter? And I said, well, we can try whitening. And she goes, well, I've tried to do that before, and this is as white as I get. And I told her, in that case, probably veneers. And so now she's considering veneers on her lower teeth because she wants them to match her bright uppers. She loves the color of the uppers and the bottom ones just aren't there. So what you do is just show them, help them make the right decision. You guide them through, and if their budgets allow, then shoot for ideal. If their budgets don't allow for the number of units you'd ideally like to do, then do what you can do right now and then add to it later. But at least the patient understands that we're going to do this in phases. We're going to take care of the front teeth to give you a really nice smile in the front, and then we'll fill in the back so that all the teeth look as beautiful and or as strong as the front ones. So what I always tell the doctors is determine what your patients want, not what you want to give them, because you may want to give them the perfect smile design, but that may miss the mark. That may not be what your patient envisions their smile looking like. We have to work at a good lab, and so through lab communication, we have to understand how to communicate with the lab what it is the patient and I want from them. We need to have a lab that can produce the quality of work that we are hoping to get back, and we have to then manage the patients. So we have to manage the patient's expectations, and oftentimes when we make our temporaries, the patient has an opportunity to see what we're looking at, both myself and the lab, in the final restorations, and so that is going to be very important. The diagnostic wax up that we make our temporaries from has to be a very good representation of what we're shooting for in the final restorations. And then another part, I put it in the notes here, is the patient has to have really good hygiene. When we get those temporaries in, if they don't take care of the gums and the gums start to become inflamed and they bleed, we're not going to put the final restorations in. I can't bond in 6 or 10 porcelain veneers properly if the gums are bleeding as I'm trying to bond them in. It can be a challenge, even if I'm using QuickStat free. If when the etchant hits the tissue, it starts to bleed again or to weep, then I really have to work that, and it makes it just very difficult. So what we need to do is begin with the end in mind. So I get the patient some ideas. We decide on the smile design. We then do a diagnostic wax up. We may do an acrylic overlay. When we prepare the teeth, we put the temporaries in. We then put the case in, make some final adjustments. And throughout the entire process, we have the patient's commitment because we've built a rapport with them. They understand what we're doing, why we're doing what we're doing, what their part in the treatment is going to be, and everything should go very smoothly because of that good communication. So when it comes down to contours, I think what I'll do is I will keep this for another episode, because this is a very important conversation we need to have with our patients. What is it that they're expecting their smile design to look like? Once again, I really enjoy doing these YouTube programs for you, with you. We're developing a community of like-minded individuals that want to offer their patients the very best. We're trying to show different aspects of dentistry, whether it be endo, restorative, occlusion, as I've mentioned before, now aesthetics, because I think as dentists, the more education we have, the more possibilities we see of what we can offer our patients. And it's good for us, and it's very good for our patients. So if you like these programs, hit the like button, and if you want to keep up with us, hit the subscribe, because we're putting these out on a very regular basis now. But give me some feedback, things that you would like to hear, some things that, some ideas that you could give back to me so that I can learn as I do these programs for you. But having this dialogue back and forth really, really helps me. So thank you very much. I hope this year is going well for you, and I will see you next week. And I think what we'll do is we're mixing this up a little bit, a little bit about materials, a little bit about technique, and then I've got these broader ideas like I'm presenting today. And I hope you like the mix. And again, post some comments so I know what to do in the future. Thanks very much.